My name's Sarah Nibs, and I'm the officer in charge of the Regional Office for Asia Pacific of UN Women. I'm very grateful to UNFPA and ESCAP for working together with us to put this event together, as well as, of course, for conducting research and analysis for the data and information that will be presented throughout this event. Vital statistics derived from civil registration data have the potential to transform people's lives. They're particularly important for promoting gender equality and women's empowerment, as vital registration and legal identity are often requirements for accessing public services, purchasing assets, and inheriting goods. To examine the importance of registering vital events throughout people's lives, strengthening civil registration systems, and ultimately improving gender equality and the empowerment of women and girls everywhere, this warm-up session brings together 3 experts in this area. So I'd like to begin by just briefly introducing our 3 panelists. So to begin with, we have Mr. Ramesh Silva, who is joining us from UNFPA, and he will begin by discussing how reliable and comprehensive civil registration and vital statistics can help accelerate progress towards gender equality and women's empowerment. Secondly, we will have an intervention from Ms. Shagufta Zareen, who is joining us from the Punjab and will share first-hand information on how CRVS data can be helpful in the context of crises, and particularly how it was used by the government of Punjab to craft COVID-19 responses. Ms. Zareen is the lead author of the paper entitled Gender-Sensitive Responses to Crises Using CRVS, a Punjab Case Study. And this was produced in partnership with UNFPA and UN Women. And just to let you know that this paper is available online today at data.unwomen.org, and we will add that link in the chat to help you, to assist you in finding it. Finally, we will hear from Ms. Siva Tanantaran, who will take this conversation to the context of the Generation Equality Forum, which was the major gender equality event that was held in 2020. And she will really look at the connections between vital statistics and gender equality from her perspective. And she's joining us from Arrow in Malaysia, from one of our regional civil society partners. So I hope that you will join me in welcoming all of the speakers, and I wish everyone a very fruitful discussion. So with no further ado, I would like to hand over to you, Ramesh. The floor is yours.
Well, thanks so much, Sarah,
Ramesh,
and it's really...
Ramesh, this is Sharita. Can you just give me 1 minute, please? There is a lot of background noise. Could I kindly ask all participants to mute your microphone when you're not speaking, please? Thank you. Sorry, Ramesh, please go ahead.
No, not at all. Thanks so much, Sharita. Thanks, Sarah. It's really a great pleasure to be with you, and we're thrilled to be co-sponsoring this side event with ESCAP and UN Women. I wanted to really spend just a few minutes today and talk a lot about how the real opportunities here to position civil registration data and vital statistics to support gender equality and women's empowerment initiatives. We've been finding very much so that this is an utilized data resource, and we wanted to share a number of case examples from not just the Asia Pacific, but also work that we've been doing in other parts of the world through our Converge initiative, connecting vital events, registration, and gender equality. And this is work that we've been doing in partnership with the Center of Excellence for CRVS Systems, which formerly was housed at the International Development Research Center in Canada, and as of this August has actually been has moved over and is now hosted at UNFPA. Maybe we'll move to the next slide, thanks. So the first thing that I think we may have skipped a slide there. We might have to go back. Yep, thank you. Yeah, so one thing that I wanted to emphasize is in terms of positioning civil registration and vital statistics to support gender equality and women's empowerment, one of the key things here is to take a holistic life course approach. In this diagram, what I'm trying to show is really the importance of not only engaging birth registration and death registration, which are wonderful data sources to engage thematic areas like gender biased sex selection and child marriage, and then also monitoring preventable maternal deaths, but also, to highlight the importance of marriage and divorce registration in terms of these are key legal instruments and key data sources to advance and underpin the rights and of women in particular, both in the household and in terms of their family relations and their broader communities. And so, super important here to take a life course approach. So in this talk, I'm going to go through a number of examples traversing birth, marriage, divorce, and death registration. Next slide, thanks. So these are maps from the Republic of Georgia. And here what I'm showing is how we've been using birth registration data to monitor gender bias sex selection. What the shaded colors are showing you are different regions of Georgia. And you can see that the very dark gray, are areas where there are very skewed, very high sex ratios at birth, meaning that there is a high sex imbalance and a lot of missing girls at birth. And so, using birth registration here has been super important to understand how how skewed sex ratios at birth in Georgia have shifted not only across time, but also across space. And this is particular. So here, birth registration is very important in terms of moving beyond just periodic assessments through censuses, which often only happen every 10 years, or household surveys, which are more every 3 to 5 years. And so this provides a more continuous monitoring resource. Next slide, thanks. Further, we've also been doing a lot of work in terms of trying to answer the question, who's missing from civil registration systems? This graph is showing you data from Ecuador, and along the y-axis down from the top to the bottom of the page, these are different regions of Ecuador. And here what we're doing is we're measuring death registration completeness in Ecuador across these different regions. The blue dots show you death registration completeness for males and the orange for females. The thing to notice here is almost universally across all these regions of Ecuador, female death registration is lower than male death registration. And then secondly, that there are some regions where it's lower by 20 to 25 percentage points. So massive inequalities, which vary across regions. And so again, really trying to understand, how fit for purpose these kinds of systems are, because and as we've seen this during the COVID-19 pandemic, if women are systematically excluded from death registration more so than men, it also leads to inequities in terms of just how well we're able to respond to the health needs of women and girls. Next slide, thanks. And then further, what we've been doing is not just asking, who's missing, but then asking why are certain people missing from civil registration systems. This diagram is just showing you a conceptual model that we've developed with the Center of Excellence on trying to understand the proximate determinants of under-registration of marriages. We have similar conceptual models for birth and death registration, but I wanted to emphasize marriage registration. And the thing to really note here is the blue concentric circles here, where we're really trying to unpack different determinants at the individual level versus the household and the family level, and then more at the broader societal and community level. Next slide, thanks. And so how does this play out? Well, I want to, here's some quotes and some qualitative data from West Africa in terms of, how people think about marriage registration in places like Senegal and Burkina Faso. And here, what we've been finding is that, often, marriage registration is deprioritized relative to traditional ceremonies and religious rituals. This is quite often at the expense of the legal recognition, particularly of women in a marital relationship and in the household and the wider community. It has massive, massive implications for property and inheritance and those kinds of well-being and security type issues. Next slide. It also plays out in terms of death registration. Here's a quote, from Morocco, from work that we did last year. This woman in a focus group said, "When my husband died, I went with my son to the civil status office. It was my son who entered, and I stayed outside." And I think this really captures, some of the real challenges of many, many civil registration systems around the world. They're not particularly gender sensitive. They're not particularly welcoming for cultural and social normative reasons. Yet of women. Yet women often bear a disproportionate responsibility in terms of registering the vital events of their next of kin. Next slide. And then what we also wanted to emphasize here was just how important not just the civil registration data and the active registering births, marriages, divorces, and deaths are, but the production and the dissemination and the usage of vital statistics are. Here's just an assessment we did in a number of countries, but here I'm just showing you what it looks like in Kyrgyzstan. As you can see, there's a whole array of gender important gender topics here, which civil registration and vital statistics speak to. Questions around femicide, child marriage, preventable maternal deaths, gender biased sex selection. And you can see here that Kyrgyzstan actually has a pretty good record in terms of generating vital statistics, which can engage a number of these questions. However, not all of them. Currently, the way vital statistics are produced and disseminated in Kyrgyzstan, unfortunately, still leaves a number of open questions around femicide, child marriage, and gender biased sex selection. So. And so here again, wanted to emphasize just how important vital statistics are to illuminating the socio-demographic situation of women and girls. Next slide, thanks. So yeah, just in conclusion.
Ramesh, just to say you have 1 more minute.
Perfect. So just to sum up. That gender transformative CRVS systems strengthening really does require a life course approach. We can't just focus on one particular vital event, but really need to take the whole gamut from birth to death, including marriage and divorce. Completeness and quality assessment of vital events. Registration, super powerful tool here to quantify inequalities in terms of access to civil registration. And this really is critical because in a number of places, we see women and girls face notable barriers, very, very different barriers to their male counterparts in engaging and accessing these systems, either to have their own vital events registered or to register the vital events of their loved ones. To which is important for their own well-being and securing their own relationships. And then lastly, we noted how important not just the registration process of vital events is, but also the production and dissemination and usage of vital statistics are, to engage really key questions of, you know, how many women are being killed due to intimate partner violence and gender-based violence, versus you know, questions around the reduction of preventable maternal deaths. Let me stop there and pass back to Sarah. Thanks so much.
Thank you so much, Romesh, for setting the scene for us. And now I'd like to turn to Shagufta Zareen, the Program Director for Health of the Department, for the Health Department of Punjab in Pakistan, who will share with us her very specific country experience. So Zareen, over to you.
Sarah, we conducted a study to analyze the data of CRVS recorded in Punjab, Pakistan, to see how a gender-sensitive response can be created to tackle any pandemic. Next slide, please. Punjab, next slide, please. Punjab is the most popular, no, previous one. Punjab is the most, next. Punjab is the most populous province of Pakistan with 110 million population, with three-tiered health structure, primary, secondary, and tertiary care hospitals. There are around 3,106 health facilities, and in all those health facilities, death is recorded manually. It was in District Health Information System. It was in January 2019 when government decided to launch a digital health system in which cause of death that is medically certified along with ICD-10 coding should be launched in a digital type of system. And this system was initially launched in those health facilities that are bearing the major brunt of the mortality statistics. So in 39 health facilities of public sector, and it was the first time we launched this system in any private health facility. So 6 hospitals were included for that. Next slide, next please. This is just to give you a glimpse of the death recording system in Punjab. Whether the death occurs in a hospital or out of hospital, it is mainly the responsibility of the relatives of the deceased to get that death recorded in the local registration system. Next, please. Next slide, please. And the main sources of mortality data in Punjab is first district health information system that records manually, but that records only the total number of deaths. Demographic picture is not clear. The major system that is recording demographic feature is the digital cord system that was launched in 2019. But when pandemic started, especially the first wave started in February 2020, that system proved a bit insufficient because we needed details of the contact tracing of the patients. We needed probable, suspected, diagnosed, and confirmed cases. So we created an extension of our digital cord system in March 2020, and that extension was named as COVID-19 dashboard system. Next slide, please. As you can see, the data that was recorded during the first wave from February to September 2020, you can see the deaths either due to COVID or non-COVID. Mainly the males were victimized by that. Though if we see the global ratio for COVID-related deaths, that seems okay because mostly the women were not suffered because of COVID. But if we see the global ratio, globally for every 10 females, 13 deaths of males were recorded. But in Punjab, there was a huge gap. For every 10 females, 25 males deaths were recorded. There can be lots of reason for that. Some of that could be, next slide, please. During first wave of pandemic, government banned all type of transportation facility for intercity specially and for intracity generally. So unavailability, non-accessibility to the transportation could be a factor. Women could not get access to the hospitals. But if they were able to reach hospitals, again, the health facilities had closed all their doors for OPDs cases. For indoor cases, only the emergency cases were dealt over there. So women were not properly handled over there. There could be another very important cause could be the women had not legal identity card, that is in the form of CNIC or computerized national identity card. In Punjab, there are only 76% women, those who have issued CNIC as compared to 91% males. So in the absence of CNIC, their death cannot be registered in the local health system. Then another could be the important reason, for that misclassification of the causes of death. Like women are dying because of some other causes, but they are not being classified accordingly. One evidence of that is before that COVID-19, chronic liver disease and respiratory diseases and chronic heart diseases, they were very important causes of death. But once COVID started, only 2% deaths were recorded due to CLD. So in addition to that, there are many deaths due to abortions, unintended abortion. That is very common. More than 50% women that have unintended pregnancies, they go for abortion. But during those abortions, those deaths are not labeled properly. Next, please. If we just see the historical picture of the last 5 years data, we can see the women who are not able to reach hospital are also not availing the services provided by LHWs, lady health workers. So a significant drop was seen in the women that are availing antenatal services, or their deliveries were handled by skilled birth attendants. And now we can infer that if women's pregnancies and their deliveries are not being handled by skilled person, that could add to the maternal mortality ratio. But when we see the figure, projected and observed figure for year 2020, the data was statistically insignificant. But we assume that evidence indicates that the actual maternal mortality could be higher than actually recorded in the system. Next slide, please. If we see the birth statistics, of course, there was a significant drop in the birth recording system. But again, there could be actual drop higher than the drop that was statistically calculated. Next slide, please. So we can just infer from all these evidences that the data recorded from the local CRVS system was efficiently utilized, but for the management of COVID only. And again, the SOPs that were drafted, whatever the policies were implemented, mostly those policies were gender blind, whether these gender were related to the patients or related to the healthcare providers. So wherever we saw gap in our healthcare system, we just deployed our HR over there without noticing the fact that whether it's mortality due to some other reason that needs to be associated factors needs to be digged out. Next slide, please. So the recommendation we found out after analysis of all that data was that our CRVS system needs to be strengthened in full spirit. And for strengthening, we first need the legal framework. Currently, we are in the process of drafting that legal framework. Since health is a provincial subject after 18th amendment to our constitution in year 2010, so that legal framework was required to be drafted by the provinces, but since provinces were not that much sensitized for the data of CRVS, and Punjab is again the first province that has launched CRVS, other provinces have yet to follow that. So that was assumed as a national responsibility. Now Ministry of Health is taking care of that drafting legal framework. Gender disaggregated data information required to ascertain the correct maternal mortality and infant mortality ratio. Again, that stays in limbo. And again, CRVS system is currently only in few health facilities of Punjab that are taking a major burden of mortalities. So we just want to expand those facilities to other health area as well. And not only in public sector, but private sector is also catering to the almost 50% deaths. So we need to expand to the private sector as well. Then interoperability of existing district health information system that is recording manual statistics, and LHW system that is again entering manual systems, but it has some electronic statistics as well, but they are somehow their quality needs to be ensured. We just want to ensure the interoperability of all those systems with CRVS system, so that exact statistics could be available to us to create a truly gender sensitive management for any future pandemic. Evidence-based decision making is lacking for women and children in most of our policies that needs all these data available with them. Then again, this CRVS system is currently a provincial subject. We just need to integrate that provincial system with a national system that is in the form of NADRA. NADRA is actually our main statistical body at national level. We are in the process of integrating the same with NADRA, so that the statistics of Punjab will be available at federal level as well. So if all these recommendations are implemented in true spirit, I think things will not be difficult to handle in future. Thank you, so nice of you. I hope I have not exceeded my time.
Not at all, Zareen. You're perfectly on time, and it was really fascinating to hear those examples, and actually very profound examples about the potential invisibility of women who are not registered. So thank you so much for that. And now I would like to turn to our third panelist, Sivananti Tanantaran, who's joining us from Arrow in Malaysia. So Siva, the floor is yours.
Yeah, thank you, Sarah. So I think, can I go to the first slide? Yeah, thank you. So my topic is basically connecting the Generation Equality Forum and opportunities for vital statistics and gender equality. And I think that Romesh has already done a wonderful intro to that. Next slide, please. Yeah, so one of the key aspects is that CRVS systems actually provide legal documentation on vital events, which are really important for us to track the life cost, of the inequality that is experienced by women, right? And as Romesh has also pointed out, that women and girls are often excluded from civil registration, and this exacerbates the gender inequality. And makes women and girls disproportionately vulnerable to deprivation and exploitation. Next slide, please. Yeah, so on the overall, marginalized populations are left vulnerable due to a number of their inability to get themselves registered. So it could be poverty, inaccessibility of registration services, unemployment, limited education, ethnicity, disabilities, and lack of benefits of civil registration itself, because first, they may not see it. And secondly, what we can find in Southeast Asia, the existence of indigenous population, or what are also groups that are called stateless, because they're unable to verify their birth order from different ancestors in order to get themselves captured into the system, which leads to intergenerational deprivation existing, right? And in this, women and girls also face major barriers. So within all of these groups, women and girls will face additional barriers, and it is compounded by the barriers previously mentioned. So, and this is around laws and regulations, lack of autonomy to getting themselves registered or entering into the civil registration system, limited agency, there are power imbalances that happen within family and community that stop certain groups from getting registered, and as well as harmful practices which are perpetuated, which result in like skewed sex ratios. Next slide, please. But vital documents are really important because it gives a person legal identity and actually establishes access to rights and privileges, right? It makes it easier to access health, education, social benefits, and inheritance. Next slide, please. One of the key things about countries that already have civil vital registration systems is that girls are disproportionately affected by child marriage. This can be tracked if births are registered, and hence age can also be tracked, right, proportionately. And this is important because we know that in a number of countries, girls are often presented as older when being married off, because the law may state a certain age is legal for marriage. The other is that, within the widows also face, discrimination, blame, and hostility. Women who die may also go unregistered, right? Because the community does not bring up their registration as for being vital. So the lack of information on causes of female death is especially important. So where women's deaths are tracked, right? And if they are tracked properly, you can see that countries that already have strong vital registration systems in place are able to attribute causes of death. And because the causes of death can then lead to program and policy change around the necessary interventions. For example, maternal deaths can be lowered because of the appropriate programs or interventions that can be done. Next slide, please. Yeah, so when policies and measures are not tailored to existing gender differences, they can perpetuate and exacerbate inequalities. And gender data can help us monitor and evaluate the implementations of policies and measures, because the changes in the data can actually kind of tell us whether we're on the right track or if additional interventions need to be made. Gender data is also important because individual beliefs about gender and gender roles are often influenced by stereotypes of old customs and traditional concepts. Next slide, please. Sorry. Yeah. So for us, we feel that, the kind of progress that has taken place in registration systems and data tracking monitoring systems that happened because of COVID-19, and as explained by Zareen, these are some of those measures that need to be taken into vital registration systems, right? And in order to improve outcomes, not just for pandemic tracking, but actually for marginalized and vulnerable populations that are often left out, because this will help us remove legal and regulatory impediments to registration, which COVID has shown that this is possible. And other barriers that should be addressed include around registration are costs, accessibility, and complicated procedures. Next slide, please. Sex disaggregated monitoring of vital statistics is actually necessary for identifying gender inequalities, and disaggregating data by sex is something that is really important that needs to be considered by all governments. And it's also important, as we said, because different countries and different, states within countries may have different barriers into benefits of civil registration. And because many do not see the immediate benefit of civil registration, working with communities in order to actually collect the data and register is an important step that we can think about. Next slide, please. Yeah. So this year, an important event took place, which is the Generation Equality Forum. And this is really absolutely vital because it takes place 25 years after the Beijing Platform for Action. So at Beijing, governments actually committed in order to improve equality outcomes for women, right? And 25 years later, we know that, this has not been achieved. And due to the COVID-19 pandemic, we're actually seeing regression. This is absolutely vital in Asia and the Pacific region because we know that it's going to take almost a century to reach some of those equality outcomes that we aspire, right? So quality gender data is actually fundamental across each action coalition. And within the 6 Action Coalition, gender data has the power to accelerate gender equality. And data, it is not only data that is disaggregated by sex, but this data is also reflective of gender roles and inequalities. And gender data reveals these systematic inequities and illuminates a path for action that can be used in order to mark progress. Next slide, please. So within the SRHR Action Coalition, we know that we have comprehensive sexuality education. This is another place where actually this data, there's a huge data gap, and gender sensitive indicators that allow us to actually create, help measure gender related changes in society over time, right? Next action is actually, yeah, so next action I wanted to talk about is the increased SRHR decision-making and bodily autonomy, because the Generation Equality Forum is critical opportunity to improve the lives of women and girls, and actually looking at the type of indicators, and this is where governments, UN agencies, and civil society can actually work together, because we know that even when there are development outcomes that are good or positive for women, that decision-making and autonomy is sometimes very little prioritized as an intervention. So gender data is essential to the transformative agenda of the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights. Next slide, please. Yeah, so we do know that reliable data is essential for these health interventions, and health data for adolescents is not always sex disaggregated. And in Asia Pacific, I do know that there's a lot of focus on the older persons, but also we have a large number of adolescents and young people. So data for adolescents and young people should also be sex disaggregated. Next slide, please. Yeah, so we feel that the Action Coalition leaders should utilize available gender data and to analyze the intersectional discrimination and develop concrete actions and build the accountability framework to monitor and measure success. And it is critical as we move forward with the Action Coalitions that, within the accountability framework that is being developed, to develop a gender data plan to actually deliver on this. For this, we need to call for an investment in gender data, and as which should be, of course, always accompanied by a costing for producing the necessary data, because quality data does not come cheaply. And quality gender data will actually enable Action Coalition leaders to develop concrete evidence-based agendas. Next slide. Yeah, so thank you for that, and thank you for inviting us to be part of this panel.
Thank you so much, Siva, and thank you so much for drawing those connections around accountability. And I think this is a really, really important and inspiring message to close your presentation on. So I'm very grateful that all of our panelists have been, in fact, super timely. And so we actually do have a little bit of time left over for some Q&A. And I have one question I'd like to ask all of the panelists to get us started. So I'd like to ask you, in your view, what would be the sort of top maybe 2 or 3 recommendations that you would suggest governments to consider in order to really improve CRVS to promote gender equality? It's a big question. I'm really interested to hear what our panelists will suggest. So if it would be okay, Romesh, would you be okay to get us started on that one?
Yeah, sure. Thanks. To me, perhaps the most pressing is to use the available data. All countries in the Asia Pacific have, civil registration systems. They're not perfect, but we shouldn't let the perfect be the enemy of the good. What we've seen many, many times over is that countries who process the civil registration data, produce vital statistics, disseminate them, through the National Statistics Office, and open up, dialogues with, academia, with, women's rights groups, community groups, and have, a broad engagement, in comparison of the civil registration data with other data sources, census, household surveys, health information system data. This helps us understand what some of the strengths and limitations of civil registration data are, what some of the blind spots are, particularly for women and girls, and it helps us to then focus on how to make those improvements. And so I think, a big message from UNFPA is let's use what we've got, and let's not be shy. Yes, there are limitations of the data. And we should document that and be clear on that, but we certainly shouldn't ignore these rich data. You know, civil registration is a country-owned, country-led system. It's permanent, it's continuous, and we hope it will be universal. And so there's much power to be gained here, and so much to be, so many opportunities to be missed if these data are not made more available and engaged by a wider community.
Thank you so much for that, Ramesh. And I would like to maybe give the floor to Zareen now. Would you like to respond to the question?
Thank you, Sarah. Ramesh was very right that in some form, this civil registration system does exist in most of the countries. But if we see particularly the Southeast Asia or South Asia, this system exists, but it's in a very fragmented form. Like statistics are being produced from one stakeholder directly going to the national office, but not going to the other stakeholders that are at the same regional or local level. And that needs that statistic to be accommodated, collateralized, like collaboration needs to be done with joint actions. So I would just recommend that first of all, these silos should be eliminated, and there should be central coordination between local level stakeholders, regional level, and national level. Secondly, whatever the policies are being made, why we don't take care of the data that is going to support our policies? So we make policies while sitting in our offices without watching the local evidence that is available in the streets, that is in the form of statistics available to us. Thirdly, somehow the data is recorded, but sex is not recorded with that data, because women's existence is not proved, so their disappearance is also not proved. So even when we started our digital court system in 2019, everyone objected, why to take care of the sex of the person who is born or who is dying? So sex is very important, so that sex disaggregated data is produced. And thirdly, why we don't take care of the women development departments and affair or other organizations that are working for the welfare of women and children. So they should also be treated as an equal partner for getting these data and using the data at any policy forums or any policy implementation forum as well.
Thank you so much for that very powerful message, Zareen. I really take note of what you said about women's existence not being recorded and the importance of that. I'd like to turn to Siva now. What are your thoughts?
Yeah, thank you, Sarah. I think that, for the longest time, every time I used to write this SRHR reports, one of the things that really made me incredibly upset and sad was the fact that in so many countries, maternal mortality continues to be an estimate, and that itself was actually, an indication that, the deaths of women were not being recorded, right? And this is why I thought, why is it that the death of a woman is not enough for someone to take out a record book and record her death, right? It's like her life meant nothing. But I believe that what has happened in the COVID-19 pandemic, that governments have already now adopted so many of these digitalization measures that they are able to actually record not only disease, but mortality, sickness. The whole, the whole trajectory of a COVID symptom, that, such similar measures can actually be adopted to a woman who has just given birth, right? To monitor exactly whether she survives, what aid can be given to her, or what kind of emergency unit could be sent to her at critical points. So I feel like that digitalization and COVID have brought this awareness of what can be done. So, and we can actually see that when government's political will is there, a difference can be made in the life of women and girls. Because I came from Malaysia, and I do know that, we do have a vital registration system that is very strong on the ground, and every maternal death is reported, and is investigated. And every 2 to 3 years, there is a comprehensive review of these deaths. so that government providers, as well as hospitals, doctors, clinics, they're actually informed of what are those signs that they need to look out, and actually at what point or what type of woman needs additional care, or referral, and hence, maternal mortality can be reduced. And hopefully, going forward, we can also see that within the COVID-19 pandemic, a lot of groups that were left out of health interventions, these are migrant populations, undocumented workers, as well as indigenous populations or stateless people, were also included, right, in the pandemic response in one way or another. And we can actually see that this is also a fundamental thing if we are talking about leaving no one behind, right, in the era of SDGs. So I feel like, COVID-19 and, Zareen's amazing presentation on that, right, actually showed, how we provide a platform, and where data can guide, decision making and policy making so that we can do the right thing by people.
Thank you so much. And honestly, after listening to the panelists, I don't think there's anything that I can say to sum up. These are really, really powerful messages, and I want to thank all of you for, giving those very actionable ideas and really making the connection between the topic of CRVS and the real lives, the survival, the visibility, and the rights of women and girls. So I'm very grateful to you all, Romesh, Zareen, and Siva, for sharing your insights. Like with all sessions, I'm so sorry that we have to finish now, but I want to remind all of the audience that this is a warm-up session, and I really hope that all of you will be able to join us later in the day. UNFPA will be presenting on vital statistics for decision-making at 10 o'clock Bangkok time, while we will have UN Women leading a session on implementing gender-sensitive CRVS systems through a life cycle approach at 11 o'clock. So I hope very much that we will see some of you during those sessions. I thank you so much for your attention, and I once again thank our panelists for sharing their insight, their expertise, and their inspiration. Thank you so much, everyone, and goodbye.
Goodbye. Thank you.